Okay, today we're going to talk about low back pain or back pain in general. So there's a lot of different reasons that cause back pain. So a lot of that can be, well, most of the time, actually basically all of the time, when you have low back pain, you will have gluteus medius weakness. That's basically a muscle, a large muscle within your buttocks. You'll have weakness in something called the multifidus, which is a muscle in your back. And then you'll have weakness in something called the transverse abdominis, which is something, a deep structure within your body. So those three muscles are very key, important muscles when it comes to stabilization of the core and of your back in general. And so a lot of things that can cause back pain, obviously if you specifically injured the back, lifting or doing something like that, you probably didn't have the right mechanics. If you're a runner, a lot of that is due to decrease in range of motion and mobility through your ankles or your hips. A lot of people, especially if you're an athlete, that's where a lot of back pain can come from because of that lack of range of motion. And it can also be caused by just other structures going on up above the back and below the back, and nerve pain, and so many other issues. And so what we like to do is work on those three muscles and strengthening those muscles within the back to help stabilize your back. So when those three muscles are weak, you now have other muscles or ligaments or tendons that are trying to take over the load of what those three muscles are supposed to do. And so that causes a lot of stress and then increased pain and inflammation within your back. So we want to definitely strengthen and stabilize those three core muscles. So if you want any information on exercises for those, please just comment below, let me know, and I'm happy to send you some specific exercises to help increase strength in that. And so one of the main things I want to talk about here is how can we manage the pain naturally. So there are five ways that I love, my 5 top choices that I use in managing pain naturally. So the first one, I just did a video, if you want to check before, on Deep Blue. Deep Blue is one of my favorite oils to use, especially with patients or anybody that I'm helping wellness visits deal with pain, inflammation, joint pain, muscle pain, post-workout recovery. Deep Blue is definitely my go-to oil. So I'll give you a little recap of Deep Blue. So basically it's a mixture of different oils. So it's got wintergreen, which has that methyl salicylate, which is basically the analgesic for pain. It's got peppermint, which has the menthol to help with cooling. It has blue tansy, which has chemazoline in it, which helps protect cells, and it's a great antioxidant to help fight free radicals. Helichrysum, which got the curcuminoids in them, which is great anti-inflammatory, great anti-arthritic for RA and OA. It also has ylang-ylang, which is great for stabilizing and managing the metabolic system. So it's great for lowering the blood pressure, stabilizing heart rate and palpitations, and so much more. So that's what comes in the Deep Blue rub and the Deep Blue oil. So they both work great. This is just in lotion form. So basically Deep Blue is anti-rheumatic, it's anti-inflammatory, antioxidant, and so much more. And for some of my people who have maybe more chronic pain or chronic issues that take a little longer to help manage and deal with, we love to use the Deep Blue capsules. This is more effective, and it has some other plant-based ingredients in it to really help with pain overall. So the Deep Blue capsules, if you have more chronic, really irritating pain. So the second one is Copaiba. Copaiba is an amazing oil. It comes in oil and capsule form. So Copaiba's main constituent is called beta caryopyline. So basically this is, it works on the endocannabinoid system. So it's a rich cannabis strain that has specific medicinal effects due to the effect on the endocannabinoid system. So you can look this up. And so basically, this selectively binds to the CB2 receptors in the endocannabinoid system. So it signals and regulates the system comprised of enzymes, the receptor sites throughout the body, and the endocannabinoids that are produced by the body. So these receptors are found widely through all the organs, the major organs, and it acts as a major regulator of human health. And so these are important because they're mostly found within the immune system. And then when Copaiba is consumed, that beta-caryopyline binds to these receptors, and it aids in healthy immune and inflammatory responses. And so it's great for multiple signaling pathways to promote healthy liver, digestive issues, kidney, heart, and brain function. So it's really great for just overall anti-inflammatory, anti-arthritic. It's an analgesic, antimicrobial, antibacterial, antifungal, antioxidant. So Copaiba is another amazing oil or capsule, whichever one you prefer to use, that I love to incorporate into your pain. So it works on different receptors, and when we're talking about CBD oil or THC, and so it gives you the therapeutic medicinal benefit without working on any of that high or any of that other stuff that we don't want, right? So there's a lot of great info on comparing Copaiba with CBD, and Copaiba has been shown to be more effective. So the third one that I love to use is wintergreen. So if I want to add in a little bit of extra of that methyl salicylate for the analgesic for pain, then I'll add in some extra wintergreen, but that also comes in the deep blue. And then the fourth one is frankincense, and frankincense has amazing health benefits for our cellular function, for overall cellular health. It's anti-inflammatory, anti-carcinoma, it's anti-depressive, it's restorative, so it helps to restore our body and our inflammatory response at the cellular level. So that's another one of my key oils that I use. I just put that under my tongue every single morning and night to help with restoring at the cellular level. The fifth one is something called Tumeric. So I'm sure a lot of you have heard of this and probably take maybe the powder form or like a gel or a pill with powder in it. So what I love about the dual chamber capsules here is that it has the powder form in it, but it also has the oil in it. So this it combines the synergy of tumerones and curcuminoids. So curcuminoids are what we find in the powder form. And so this helps to fight free radicals and protect against oxidative stress within the body. So it helps to create a healthy inflammatory response. So we want, like our body is made to respond to inflammation. So if you work out, we're going to stress the muscles a little bit or some other components within the body, and naturally our body will have some natural healthy inflammatory response to help the muscles recover, so that's good. But obviously too much or over inflammatory is not good for our body, so this helps to regulate the curcuminoid of the powder form. And then you've got the oil form, and so the oil form is also great for healthy inflammatory and the oxidative stress as well, and together it increases the bioavailability of it into your body. So my absolute go-to is I do every day the deep blue capsules, the Copaiba capsules, and the dual chamber turmeric capsules to help with managing pain. So if you have any question and want to know more about how to manage pain naturally through essential oils, let me know. If you want to know some specific exercises to help with low back pain, please comment below or send me a private message, and I would love to help. Make sure to visit my website, www.theptdocswellness.com. All right, bye.